Greetings to one and all. Myself, Dr. Tarun Prashant. So, today the topic that we'll be discussing is bone healing. So, defining the objectives for today's class, I think the first thing that it needs to hit your mind is why is bone healing that important and that different? So, a brief introduction on how it's different from the other types of healing that occurs in the tissues in our body. Going on to the types of bone healing, the stages of how a bone heals, factors influencing bone healing, and a few clinical examples of how the bone heals. So, how is healing of the bone different? You need to know that once a fracture occurs, the first thing or the first doubt that comes to our mind is whether a bone heals. When does it heal? When doesn't it heal? And how easy it is for everyone to find out that a bone is healed, whereas any other tissue in the body other than the skin, we never know how good the healing is. So in order to know that, you need to know that bone healing is a very complex process, but it's a very well orchestrated process that results in constituting the bones back to alignment without formation of a scar. So that's the most important thing. You need to know that in bone healing, there isn't any scar production, as in the case of a skin or any other tissue in our body. So, the prerequisites for this to occur, it needs a coordinated interplay of multiple cell types with the local and systemic cytokines that are passing on in our body, along with a few growth factors, and this local milieu is influenced both by mechanical, which is internal, and external variables on how a bone is going to heal. So, the first thing that you need to know is there are two types of bone healing. You need to know that there is something called as a primary bone healing and there's something called as secondary bone healing. Why is it important for you all to know this? You need to know that bone healing doesn't mean production of callus. I think that's the first point that you need to know. You need to know that the bone forms in different parts based on how they are fractured. So, now going into each of the types and after that the stages. So, when you come to primary bone healing, this is a healing wherein the fracture is not going to heal with production of callus. So, there's no concept of callus when it comes to primary bone healing. So, what is primary bone healing? In primary bone healing, there is absolute reduction of the fracture wherein the fracture or the bone is almost in its anatomical position and it's fixed in such a manner. So, this usually occurs when we are going to keep both fracture fragments that are broken in 100% contact with each other. So, what happens when you're going to keep them in 100% contact with each other is the whole fracture line is closed. So, how does it heal? It heals by something called, which was initially called as primary intention and further on pseudo autogene, but following all the studies, it was called as direct or primary bone healing. So, the type of healing is intramembranous healing, wherein you use it by the terms creeping substitution. So, bone healing by creeping substitution through cutting cones. So, here you can see a diagrammatic representation of how the bone is healing, where you can see the multinucleated cells of the osteoclast which are entering into a fracture site, and following it are the osteoblasts. So, the cutting cones of the osteoclast go in and resorb the bone at the fracture site when both bones are attached to each other, and the tail as a conical surface which comes down over here is having the osteoblast which lays down the new bone and further causes a normal turnover of the bone. So, in this type of healing, there is no cartilaginous component to it, wherein the bone goes in, it's eaten up, it substitutes, and again bone is formed. So, it's initially gone by the osteoclast followed by the osteoblastic activity. which means bones are resorbed, and following which bone is further formed. So this occurs in something called as an absolutely stable construct. We'll be speaking about that in a bit. So the other important point that I've been mentioning here is you need to know that this amount of strain that goes through the fracture site in order for a bone to heal by primary healing is that the strain is less than 2%, which means the amount of the possibility of that fracture to maintain the length or to maintain the innate stability of it, only when the strain is less than 2% are you going to have a primary bone healing. If it's going to be more unstable, or if there's going to be more micromotion which is going to occur there, what forms is a secondary bone healing. So bone production and opposition to fill the fracture gap occur by the osteoblasts in the same way how the house-shaped lacunae are filled after the action of the cutting cones. So it occurs in cases where anatomic reduction and rigid internal fixation, or in other words, whenever you try to plate a fracture, when you're going to open the fracture, you're going to reduce both the fracture, you're going to strip off all the periosteum, make sure it's 100% in contact with each other, and after that, once you internally fix it rigidly with a plate, this is the type of bone healing that you will expect. So it is also called as intramembranous healing or a healing by cutting cones or creeping substitution. You need to know that in this type of healing, what you cannot see is you cannot see a callus. So the fragment end resorption which usually occurs following a fracture does not occur. No callus is formed, and the form of this form of bone healing is very less frequent, as in at least for patients who are going to be treated non-operatively, this type of bone healing cannot occur unless it is going to be a undisplaced fracture.